Thank you for joining. This episode is definitely a special. On today's episode, you will learn a lot about intimacy, sexuality, and men's health. I'm really inspired to have this guest today, Dr. Arthur Burnett, a globally recognized Johns Hopkins urologist, researcher, and educator whose pioneering work in men's health erectile function has transformed care worldwide. Arthur, how are you doing today?
I'm very well, thank you. Delighted to join you.
I heard that you were doing surgery today. Is that true?
Oh, that's true. That's true. Yeah, I think that as a urologic surgeon, I periodically have to go do some surgeries. So
Yes.
guilty is charged.
Keep yourself busy. Well, I'm grateful for your presence here since I think you and I have very similar goals, which is improving men's health and well being. So, the very first question I have comes from the public, and here we go. Why do men have such a trouble with excessive urination when they're getting older?
Yeah, so this is a common phenomenon that men, as they get older, do have urinary symptoms. We use the term LUTS, which stands for lower urinary tract symptoms. In
Hmm.
fact, we have a diagnostic code for this. And in point of fact, it's not just men. Women also have some voiding dysfunction as they get older. Now, men, we think of having issues because of the prostate, okay, and this organ deep in the pelvis that has been associated with urinary difficulties. And so we do know there's a phenomenon there sometimes with men having prostates that become obstructive just with aging. Okay. And then the obstructed prostate and urine passing from the bladder and then out to the outside world have this kind of, if you will, a donut hole that's gotten tighter. And that obstructs the urination and it causes a lot of bladder disturbances. Now, same time, now I mentioned women too, because part of the phenomenon may also just be as we all get older, our bodies change. And in men and women, and as we get older, the bladder gets somewhat more disturbed as well in terms of urinary habits. And these urinary symptoms can be symptoms of an obstructive prostate, such as slow stream, hesitating to void, not sure that you're emptying your bladder completely. All of these are kind of obstructive symptoms, but there's also some irritative symptoms where the bladder, sometimes in a reactive way, leads to a lot of urgency and frequency and back and forth to the bathroom and getting up at night, and maybe even some urge leakage, urge incontinence. So these are also the urinary symptoms that you're speaking of.
Is there anything that we can do at a younger age in order to prevent that in the future?
Well, excellent thought, because if this is so common as men get older, what else can we do? And one easy answer is don't get older. Um,
That's a
so
tough one.
I don't know if we can get around that. Um, but certainly basic considerations that we all think of in terms of lifestyle habits,
Mhm.
exposures, and things of that nature. The quick answer is anything that we do in a healthful way for our bodies
Mhm.
that have to do with heart health, cardiovascular health, also has roles with prostate health in general.
Mhm.
But some of this may be genetic, and it may just be older, and it may be hard to get around some of the phenomena.
Which brings me to this next question. Specifically, when something is generic and we know that we have that predisposition, perhaps it's time to know that this is something that we're gonna be facing more, definitely as we age. So those are the ones who probably.
Something to think about. You're right, and in fact, it's not uncommon that we'll see within brothers or our father had a situation, and the son comes in now, and he's around 60. He's starting to have urinary symptoms too. That there may be something related to each one of us thanking our ancestors, thanking our parents and grandparents and great grandparents that some things get handed down
Yeah,
right to us.
yeah. We wish was different, but that's what we got, right?
Yeah, that's right. That's right.
When men experience changes in sexual function, what emotional reactions do you most commonly see beneath the surface? Shame, fear, grief, confusion, and why do so many men struggle to talk about it?
Sure. Well, that's a loaded question.
Yes,
Um,
I thought I gave you an easy one at the beginning.
So we pivoted to sexual dysfunction in men, and I think all of the above. I mean, the reality is that we're almost taught in our culture, in America, but many other cultures as well, that we have to have a certain amount of machismo, bravado, and toughness, and masculinity, and all these kind of funky things. And sometimes the reality is very different than that. The reality is that our bodies change, and men sometimes will have change in their sexual functioning, and there is a sense of, well, am I living up to be the man that somehow I thought there was an ideal that I needed to be, or maybe a partner thinks I should be, or maybe you just feel yourself that I needed to be, a better man than I think I am sexually now. And I think there are some realities that some men will have some decline in their sexual function, and it can be a source of shame or embarrassment. There's a stigma there, as I said, because everybody thinks that everybody should be the Marlboro man, but that's just not always true. But we have to come to terms, I think, with this. I'm sure we need a more discussion on this, that we have to get past this shame and embarrassment, recognize that this is the reality of life, that there are health issues here. And that doesn't mean any man is less than whole. Doesn't mean a man is any less than a man. I always tell guys, it's just something that's happening. We'll address it. And then we have ways to address these issues. But you're no less of a man. And let's hopefully be reassured and help each other. Now, women, help your men. Don't try to shame them. Help them understand they're still men, and they may need to just step up with some interventions.
Since you bring that up, what would be the ideal way that we women or partners, right? There's no,
Yeah.
can
Be
help.
partners of any kind.
How can we be more sensitive and more open? Sometimes because of the stigma of shame, it's difficult to ask questions or to approach the conversation, to start even the conversation. So how can be done in a way that is caring?
Well, I think that first, I think just knowing that your partner, your male partner here, well, needs to be supported, but not supported, in an artificial way, in a contrived way. Honey, you're fine. Don't worry about it. You're still a man. I love you. Just even if well, that kind of talk, I'm not sure always is that supportive. I think you want to be supportive, but also say, hey, yeah, I'm with you. And yeah, our bodies change. My body's changing too, honey. And but let's just be forthright about it. Let's be supportive in a genuine way, and let's talk about it. Let's figure out ways that we have to age together, maybe, and figure out what can still be satisfying in life. And let's get the proper assistance from a healthcare provider, a clinician who can really maybe help address our health issues, and maybe find out what's correctable, find out what things can possibly be brought to the situation so that we can have a satisfying, intimate life as partners. So I think just being genuinely supportive and just helping each other, just be thoughtful about just being mature and saying, okay, this is real, and we can address
In other words, call Dr. Burnett.
it. Well, that too. But I think for your audience listening, I congratulate everybody listening, because I think
That's
that
the
does
first step.
reflect. Yeah, it reflects that you want to just be more informed, and you want to just kind of understand the truth, and not all kinds of misinformation out there that happens, I think, unfortunately, and that you're prepared to just be an authentic, true person for yourself and for your partner.
You mentioned earlier being correctable or non-correctable. What is the difference and how would they know? Tell me a case when it was something that was correctable or not correctable.
Well, yeah, so correctable things may well be that there's something that's happening in your body that is a health condition that we recognize and say we got to get better. I'll use the example of testosterone in men. We do know that some men, as they get older, their testosterone level, this male hormone that has to do with maleness, in terms of male strength and sexual functioning, sometimes more for libido than erections now. So sexual interest than erections, libido is interest, but maybe even cognitive functioning and muscle strength and bone health and all these other kinds of things may relate to that. So getting a good health checkup. Another one is cholesterol levels or cardiovascular fitness and lifestyle and cutting out smoking and getting more fit and eating the right foods and getting some exercise routines. These kind of things also then can have at least potentially some ability to reverse the adverse health effects that your body is dealing with, including sexual dysfunction issues. So these are kind of correctable things that I think can be worked on, and if it's done in a constructive way, maybe that can help a person derive some benefits.
In your experience and perception, what is the most common mishabit or bad habit that men do that affect their function?
Well, I think men, and I hate to stereotype, but I think men sometimes, as they get older, are less active. They may adopt some unhealthy lifestyle situations.
What is unhealthy lifestyle?
Well, there could be a whole host of things. I mean, we just talked about not getting a certain amount of just health fitness.
Mhm.
Maybe just trying to get some basic exercise in 3 days a week at least. So
Okay.
just getting out, just doing some what do a good walk every now and
Hmm.
then, and maybe with some sort of routine, dietary things. Okay, eating a more healthful diet. Many men, I think, and women too now, and maybe we need to be encouraging our young people are eating just processed foods too often, not fresh fruits and vegetables, not a balanced diet. Another big one is getting your proper rest. Okay, I'm kind of guilty of that myself, being a surgeon. In my younger years, I would just say, okay, if I just sleep whenever I can, I'm good. But I tell you, once you get in your 60s or whatnot, you have to realize that let's just be realistic, get your normal sleep, feel good about yourself, and that I think also is very important in terms of good health. And of course, and of course, other things are just the big things. Excessive cigarette smoking or drinking alcohol and things that's very, these kind of things. I mean, automatically, we have learned now, unlike where we were 50 years ago, where everybody said you got to smoke cigarettes to be a tough man. Well, hey, we've learned over years that cigarettes is not good. It leads to cancers, it leads to various lung conditions, it can lead to various other adverse cardiovascular health issues. So, so that almost goes without saying. Cut out the bad habits and then try to pursue some of the most helpful habits.
Mhm. What is the most common questions that you've been asked by your patients?
Well, some of the common questions as a urologic surgeon and a men's health doctor, if you will, and I am very keen about men's sexual health, so I do have a clinic that's directed toward that. So within these kinds of contexts, many men ask questions about, how can I achieve better sexual functioning? Uh, and testosterone is a big one. I mentioned that earlier
Mhm.
because I think there is kind of a sense out there that, just give me some testosterone and it'll fix everything. Well, it'll help sexual interest. It may help some of these other healthful things I talked about in terms of muscle strength and bone health and cognitive function, thinking, being able to think and things like that. But not all men really have necessarily low testosterone levels. We have to just run the tests, and if it is low and you do have accompanying symptoms, then I think maybe would give that to you, but give you testosterone by a prescription now. But my point is we can't fix everything just by saying take some more male hormones. Part of it is getting the right health fitness, the right healthy lifestyle, and if testosterone your testosterone level is found to be low, getting a prescription makes sense to improve that, along with meeting some of these other healthful goals as well.
Excellent. I'm going to choose another question from the audience.
Sure.
Uh, or actually, this is a better question. You spend years working at the intersection of sexual health and men's overall well-being. In your view, how closely tied are a man's sexual confidence and his sense of identity? Not just manhood, but identity.
Yeah. Well, I think this is very important. I think that culture has a role in how we think of ourselves as men. Um, and that's a huge influence. But just again, just masculinity and maleness, many men will identify with a certain sense of muscularity, certain sense of power, certain sense of strength. All these kinds of things, I think, are wrapped into this identity of what manhood's all about. I'd like to make the additional remark that while I celebrate those things and want men to be as fit as they can be, they should also understand that manhood also is identity with regard to responsibility and authenticity, uh, like, doing healthful things, uh, supporting your family in many different ways. So, I mean, the other aspect of manhood and identity is just being a good citizen as a man,
Mhm.
a leader, head of the household, let's say, and being a good citizen for your sons and nephews and young men in the community. So that I think identity should be some of that too. But I think our culture drives a lot of it, and conveys this notion that men have to somehow be Mr. Universe or something of that sort, yeah, or Mr. Marlboro Man back in a few decades back, that you're not macho enough, then you're not a true man, and there's this identity that goes with that. In my point of view, men come in all sizes, all shapes, all ethnicities, all interests, and maybe some orientation sexually even, and that doesn't diminish anything about man. We're men in all different ways, and so it's not just one kind of just one construct here. Even though sometimes our society tries to make it look like that.
That was beautiful, Arthur. I love what you just said. Thank you. Performance anxiety can become a vicious cycle. Can you explain what is actually happening psychologically and physically when anxiety starts interfering with intimacy?
Sure, sure. So we're talking about performance anxiety and how that may interfere with intimacy. And of course, this term performance anxiety has been around a long time. You
Excellent.
know, we,
Mhm.
and it can be many times in younger men, but even older men. And then I guess we associate it with in the bedroom, yes, the man who's trying to have intimacy with his partner, and just in a way trying to get a sexual organ in a way to be able to have intercourse, and just can't get to that point to be able to be
Mhm.
intimate in that way. And so we use this term oftentimes in that context. But this speaks to the reality that sexual functioning is a mind body thing. You
Mhm.
mentioned the psychological, the physical.
Yeah,
You know,
correct.
I mean, the men are not rats running around the floor here. I mean, we have emotions, we have thoughts, we have feelings. I mean, we need to be real about that. We also have perhaps anxieties and depressions and things of that sort. And that's but it is true that some men may create a kind of this kind of emotional and psychological or kind of mental health negative effect sometimes in sexual encounters, and that can interfere with abilities. And sometimes it has to do with interpersonal relationships too. A certain individual may respond better with maybe I'll just use an example of somebody who's they have had partners in the past and may say, okay, a certain partner I can interact with and I can't with somebody else because maybe the other person doesn't create the right dynamic and creates more anxiety. So all these kinds of things may be in play. But again, sexual performance is a mind body experience. Physically, there may actually be some reality that is not all just mental, that sometimes the body has this kind of fight or flight response, developing kind of a revving up of energy and our own cortisol and I'm using some medical terms here, and even said your adrenaline starts pumping. Adrenaline is kind of the thing that kind of gives you your blood pressure going and get your heart racing and things like that. Yeah, and actually there may be a real hormone release of these adrenalines and other kinds of body chemicals that unfortunately don't have a conducive effect on how the erection happens, and actually may cause penile flaccidity, the penis to go down instead of stay up. So there may actually be some physical aspects to this too, not all mental, but you can see it's complex. It's a complex matter here. This performance anxiety is partly the mind, and it can also be an extent of the body.
Yeah, because you just said that, well, sometimes they just come to your clinic and say, "Give me more testosterone," and isn't that created more when the sympathetic part of the nerve system is activated?
Well, you're right. So yes, you mentioned the word sympathetic nervous system, and I was trying to avoid a lot of funky medical terms this time to confuse the audience. But yeah, the body has parasympathetic, sympathetic. Parasympathetic is what runs our organs in our body, just keeps things kind of at a baseline. The engine's running kind of status. The sympathetic is when things kind of go in overdrive, and changes things.
Fight and flight.
Fight and flight, where it's like, okay, I'm really highly anxious and something's tense and maybe a sudden disturbing mood happens or this or that. So all these things are reflective of the sympathetic nervous system with adrenaline that may be part of really the physical response that is counterproductive for intimacy.
So basically, what you say, yes, it creates testosterone, but at the same time can also affect in another way, right?
Sure, sure. And testosterone, is interesting. That testosterone probably more than likely is not going to change from moment to moment. I mean, it's certainly having the right overall health status in the body, and getting, believe it or not, getting the right sleep, getting the right diet. That probably leads to getting, a better sense of fitness, losing some weight, just doing healthful things will help bring a man's testosterone level higher to begin with. But these sort of things, I think, are kind of a more constant over days, and once you get a steady state
I
of
see.
how your testosterone is probably is what's going on there. In an immediate context of a partner, and you're in the bedroom and so forth, uh, yeah, I think it's more likely the sympathetic nervous system that moment to moment can get funky.
So activating the rest and digest, the parasympathetic, meaning women make an harmonious and relax for your man, right?
Sometimes that's the right thing to do. That's the right thing to do. And then again, I don't want to be too prescriptive, and I don't want to beat up on the women or the partners, but
Of
it's
course.
also one thing to just kind of accept that sexual activity often it should be said to be a couple's experience many times.
Well,
So figuring out how to have that interpersonal relationship and talking it out and making sure everybody feels like they're kind of hearing each other and responding appropriately and constructively to each other. That is part of the secret to really have good activity.
dynamic. Excellent. Next question. A lot of men quietly wonder, is this just aging or is something actually wrong? How can men tell the difference between normal age related changes and something they should address with a doctor? Or should they always address to the doctor the issue?
Well, I think to some extent you're right. They don't always just presume you're gonna just know things from various informational sources that may not be correct. I think it is to be reasonable, and certainly my thoughts that men should be prepared to go see a physician, at least a regular general practitioner or a primary care physician. Doesn't have to be a high level surgeon. I'll use myself as examples, for an initial visit, but that should be part of your healthful habits. Women, of course, learn to see a doctor from their teenage years many times. And many men, they once they kind of get out of the pediatric age range, don't see anybody for 50 years. Yeah, that's unfortunate because our bodies do change. And I think the context of what you're saying is that, we all can benefit from somebody who's a more of a medical authority, hopefully somebody who truly is trained as a clinician. It can be a physician. It could even be a physician assistant or even nurse practitioners these days
Mhm.
who can really help you understand what are really true medical issues and work towards a lifetime of good health, and make sure you do that. And if you start to have something that really goes awry symptomatically, but also sometimes we don't always have symptoms for things. That's why you should have checkups. Let that healthcare professional help you get guided in the right way.
Do you provide that information in your clinic, or you know of a great way of resourcing that information?
Well, I get fortunately I work in a medical center here where I do have colleagues in these other disciplines, including primary health. So, um,
Where are you located, Arthur?
I'm at Johns Hopkins here in
Oh,
Baltimore, Maryland.
that's
Yeah. Uh, yeah. So you may have heard of it. I've been here 43 years. But it's a situation where I think that wherever you are, there are good medical centers. Um, seek out these medical centers, and men, don't just be ashamed to say, well, I think I'm feeling great. I don't need to see anybody. I'll take all this in my own
Mhm.
hands.
It's like the
Yeah.
pride, right? The macho pride is.
Yeah, not necessary. I mean, certainly maybe once you get in your 40s, it's maybe worth getting a health checkup, if not earlier. And then maybe have some regular checkups based on maybe that initial health screening and then recommendations for good health habits going forward.
What make you dedicate your life to study and learn and help men with this matter?
Well, I think that my interest in men's health has come about, I think, through recognizing both my interests, my aptitude, and also just I think societal needs. Um, certainly with the previous discussion there, I went on to college and medical school and had an aptitude for science and felt that becoming a physician was something I could do, and I did have, fortunately enough, support from others and blessings to be able to get through all those tough chemistry courses and things like that, and actually become a physician and then see myself being a surgeon, which I think resonated with what I just thought my talents and my professional aspirations should be. But I think also, I'll be honest with you, I recognize that there's a need for somebody, myself and others, who get into men's health.
I
We need to do that, particularly in the under resourced and underserved communities out there.
Mhm.
I'm referring to men who are in really ethnic groups, including Black, Hispanic men, and others. That I felt that guys like me, who could really be trained physicians and doing things like we're even doing right now, could have really good impact.
You perceive that, and I usually don't like to compare the two different genders, but between men and women, do you perceive that men gave less attention to their health and their doctor visits than women? Or I don't know, you mentioned women earlier, but in your perception, or also some different backgrounds are different also, and I only ask these questions because I perceive that I come from a Latin community, and I perceive that we visit the doctor less than the United States, and I could be wrong, right? That's what my perception growing up. But you perceive that this occurs into different genders.
Well, I think across the genders, and then you also allude to different ethnic populations. Things could be different too, but just between men and women, I think it is unfortunately the reality that women have female the issues in terms of gynecologic care and things of that sort that men don't have, and then I think women that do. Perhaps even in their teenage years, start to see a doctor just to address these kinds of
Mhm.
things that
That's
happen.
true.
And that kind of gets you kind of in a way directed along a path that you are familiar with coming to the doctor in a way. Men don't have that in general. And so, unfortunately, I think that is a big factor that kind of unfortunately directs men away from healthcare. And in addition to some of the things we've talked about already,
Mhm.
cultural factors, historically, men are thought to be you don't need a doctor and you just brush it off and you don't really have health issues. So I think it really is some true differences between men and women, but also maybe a lot of cultural factors that perhaps even across ethnicities,
Mhm.
where men are less apt to be familiar with getting regular health checkups.
I agree with that. All right.
Yeah.
Next question. For men in relationships, what are the most important conversations to have with a partner when sexual changes begin to affect intimacy?
Well, again, a very loaded question. Uh,
Oh,
you
you're
know,
the expert.
well, yes, I am, but I'll bring to me the just common sense discussion. Being a surgeon and a men's health expert, sometimes when patients come to see me, I tell them that they may really need to see a counselor. They may need to see somebody who really is trained in um, sexual therapy and counseling and things of that sort. And so I think that again, I want to. My point is I want to respect that those who really are very focused in these areas should be supported, and patients and community members, you go to those people. They really can offer things to you. I mean, I know some patients want to see me because they say, "Doctor, you're the surgeon," but at the same time, I have to say, I'm in a certain lane here that I reconstruct pelvises. I do various complicated reconstructions and in the pelvic area, take cancers out, this and that. I can't be everything, but I mean, but being a physician and at least having a basic background in the area, to answer your question, Elaine, I guess the point is that again, it comes down to authenticity. It comes down to just saying, okay, yes, is it possible that as the years go by, our bodies change, our health experiences some adversities here and there, and we just need to just step up and be honest about that. But if there really is some conflict in the bedroom, that may also occur. Sometimes that occurs is many couples just get older and they're not quite as frisky as they might have been in their 20s.
Mhm.
There's reality of natural bodies changing and things of that sort. But if things seem to be unhappy between members of a couple, partners, then I think that does mean that they're not on the same level with which they want to carry on with their intimate experiences. And perhaps that does require some professional help.
Okay, for sure. That is there's a bigger concern right there.
Sure,
Are
sure,
you the
sure,
right
yeah.
person? Um, what do women or partners often misunderstand about what men are going through when they experience erectile difficulties or other sexual uh, changes health?
Well, I think that again, you were referring to just how there's importance in a couple's situation. That interpersonal dynamic, and then say how should a partner react to that man who's harboring erectile difficulties, and certainly we got to remain supportive. We have to to kind of acknowledge that changes may be occurring, and rather than try to promote the embarrassment or exacerbate the shame and that sort of thing. Uh, and sometimes create more problems. We don't want that. We don't need to be judgmental. We don't need to be kind of saying, "Why aren't you the way you were 20 years ago?" Um, I think you just have to realize as partners, or whether you're a partner, man or woman, for a male partner, that a man's body could be changing just like women's bodies can change, and we shouldn't be judgmental. We should otherwise recognize that if that man is having some difficulty, let's say okay, let's address this and get you to a healthcare professional, then maybe able to help you get your function where you want it to be, and just work through this in a very constructive way.
So when there is when the problem is psychological rather than physical, are you able to help those individuals, or do they need to go to a different doctor?
Well, for that specific question, if I feel that it may be a bit of a mind thing and a body thing,
Hmm.
maybe it may just come down to just having some basic discussion that I can offer, and maybe even a prescription for something that's not going to be irreversible or invasive, like prescription for one of the oral erectile dysfunction medications that we have now in the past 30-ish years now, 25, 30 years. And then that may give a bit of a boost, and and then just some basic discussion about helpful things to do, as we already talked about. Maybe that'll be enough, and then that person will work with it, and next thing you know, they're fine. At the same time, if it appears that the person has tried these other medications and they're not that beneficial, maybe they've already made some lifestyle adjustments. It's not changing things. Maybe they're showing a great deal of anxiety, a great deal of stress, and maybe even depression surrounding all this. Then I may just have to just kind of understand that, and then offer a strong suggestion that, well, why don't we get somebody who is a counselor or a specialist in sex therapy or counseling involved, and then try to encourage that person that that's again not something that's going to be a stigma, not something that's going to kind of suggest that something's wrong with you. Again, that's not something that's going to somehow suggest that you're a crazy person. No, I mean it just suggests that this person that somebody who can be professional in this area
Hmm.
can give you some guidance and maybe be helpful here. And so I try to give that tone to the conversation.
Of course.
That is a very positive thing, and there shouldn't be any kind of negative association with any of that.
Excellent. Um, you're known for practical evidence-based guidance. What are some of the most effective first steps a man can take if he wants to improve his sexual health without spiraling into panic or self-judgment, like you said
Yeah,
earlier?
yes. Well, you're right. I've been involved with various guidelines. I was the main um, consultant, if you will, that was involved in the American Urologic Association guidelines that was published a few years ago.
Mm.
And so I stay very involved with guidelines and trying to help move things forward, recognizing that this is a real health issue, not to be lessened or discounted any more than other true health issues that maybe cancers or other things that happen in the body. So I'm keen about all of that, and I think that the first the first thing to do is that we talked about is identifying the problem, recognizing it, and then understanding that we do know that there are many associations that we can work on. I mean, they're back 30, 40, 50 years ago, we just kind of associated male sexual dysfunction with the various kinds of psychological issues or hormone issues or whatever. I think we now come to accept that many times these days, and we should have understood this even way back then, but we've learned it more and more, is that health conditions do play a role in why we don't function. Diabetes, cardiovascular conditions, cigarette smoking, poor health habits, all these kinds of things are real adverse health conditions in the body. And so it's not all just, crazy things in your mind here and that may be associated with erectile performance issues going back in the 70s, the 80s, and things of that sort. So I think just really recognizing the problem, looking to try to get some counseling, understanding the mind-body experience, and maybe just starting off with some of the oral medications along with some lifestyle changes. These are some of the initial steps to take, I think.
Would you be able to share a case, of course, without a name, of a time that you were able to successfully help one of your patients, and what was the situation and how you helped them?
Well, absolutely. Certainly, being a urologic surgeon, I'll have patients that are on the far end of the spectrum that really need true surgical interventions.
Mhm.
In fact, today they had two men that had underwent penile prosthesis surgeries,
Uh-huh.
which I've done thousands of over 35, 40 years.
Mhm.
For men who may have very serious erection difficulties. Some have had prior pelvic surgeries. Some have had very bad diabetes and have failed conservative management options. So, moving forward with some of these men who really have never gotten erections for a few years now, maybe they've even had a prostate radiation treatment or something, or a surgery, lost their erections. And when the oral medications have been tried, or even a couple times, no help. Uh, and so they really need a serious intervention. So as a surgeon, I can tell you, yes, I've had impact where I've had some guys say, I sat on this now for 5 years. I'm glad I did it. They're coming back to see me now a couple months later, said this changed my life now. I can be intimate again. So you can see how transformative that kind of intervention can be. But that's pretty significant invasive kind of treatment.
It is.
But things could be less than that too. And I'm not telling the audience that they need to jump all the way to having a surgery done with a rod put inside the penis.
Oh,
It could be the most basic thing that we kind of already talked about, which is just an initial discussion and just trying to be a little more healthy, and then a trial of oral medication along with healthy lifestyle changes.
mhm.
That can be transformative too.
Yeah, because I will think that a situation like that, they might just sit and wait and be stressed or depressed or anxious or all of these emotional things,
Sure.
and take time and wait and instead of make a decision, because it's a might think that it's a difficult decision or believe that there's no help, and it's best to just address it and move on, and not having to get to all the additional unnecessary anxiety and depression or sadness or whatever the situation, grief, whatever they're experiencing, right?
I couldn't agree more. Absolutely. So sometimes, again, the first step is just acknowledgement and acceptance that there's nothing really matter of just beating yourself up about having the problem.
Mhm.
Don't have that adverse self judgment. So just kind of try in a way say, okay, other guys have erection difficulties. Let me go talk to my doctor and let's see what we can do about it.
Mhm. And yeah. Okay, so what would you say to the men listening right now who has been avoiding this subject out of embarrassment, but knows it's affecting his confidence, relationship, or quality of life, which is basically, I guess, something of what you just answered.
Yeah, more or less, it is something along what we're saying, but again, I did glad to speak to it again to give a little more emphasis to the fact that again, um, let's not bring shame to ourselves, and our partners shouldn't bring shame to us either. We're human beings. We're men, and then we just need to accept that our bodies may change, and we need some help every now and then. Sure.
What is the biggest myth that you have heard around this subject?
Well, there are all kinds of myths. Myths about having a certain size of a male organ or a certain sort of sexual prowess.
Mhm.
Uh, I think unfortunately we do see these kinds of myths that I think are adverse. So I'll give you the example. All too often we're seeing I think some ads out there and perhaps kind of a influence within social media that even 25 and 30-year-olds should be taking a lot of Viagra, a lot of these oral erectile dysfunction medications, with some sort of sense that, maybe they're being pushed by partners, but maybe they have a sense themselves
That's true.
that somehow they should be having abilities that are just beyond normal.
Mhm.
Uh, and then, why can't you perform, honey, for 3 hours? I know Joey down the block can do that. I mean, things like that. I mean, that's just not helpful. And it's also psychologically devastating in many cases. So I think that we need to just try to help people know what are real bodies functioning as. What is the real ability of the penis? What is the normal size of the penis? What is normal sexual functioning in the bedroom? All these kinds of things. Hopefully, we can continue to kind of dispel myths that are opposite of what's truth with some of this stuff.
Excellent. Um, are you ready for some rapid fire questions when I say one or two words and you answer quickly whatever comes first to your beautiful mind?
Ah, well, I'll try it. It sounds like a game show, but I guess we'll do it.
This is about how a men think, basically.
Oh, okay.
Okay. Career. What do you?
Urology,
Mm. Health.
goodness,
Women.
beauties,
Suffering.
sad,
Social media.
influential,
Stress.
difficult,
Fatherhood.
a good thing,
AI.
challenging,
Profession.
society,
Mind.
beauty,
Evolution.
reality,
Happiness.
wonderful,
Gratitude.
also wonderful,
Authority.
a reality,
Leadership.
excellence,
Parents.
tribute,
Authenticity.
beautiful,
Emotions.
reality,
Legacy.
truth,
Music.
beautiful,
God.
thankful,
Spirituality.
personal,
Connection.
outstanding,
Society.
real,
Pornography.
complex,
Fulfillment.
purposeful,
Fear.
reality,
Knowledge.
excellence,
Men.
beautiful,
Transformation.
reality,
Identity.
reality,
Husband.
partner,
Wife.
partner,
Empowerment.
strength,
Pleasure.
humanness,
Pain.
reality,
Sex.
beautiful,
money,
reality,
family,
purpose,
physical body,
beautiful,
conversation,
beautiful,
manhood,
purpose,
intimacy,
purpose,
wealth,
life,
polygamy,
complex,
monogamy,
a good thing,
love.
wonderful.
Great. That was the last one.
Okay. You're
Um,
making me think here. I think after a long day.
Good.
For a long day. Yeah, but that's okay.
All right. So, Arthur, is there anything as we close this conversation? Is there anything for you that is important or that you perceive that we haven't talked about that the audience needs to know about this specific subject that is still relevant and important to address?
Well, I think that the questions have been great. That helps me know that what the audience wants to hear. I think I've kind of weaved in various thoughts that I wanted to share, and then just echo those things again. That you know, a true man is a man who's authentic. A true man is a man who is not trying to live up to some sort of artificial kind of ideal of what a man is maybe considered to be through various all kinds of artificial media that's going on out there. Get your health checkup and be there for yourself, for your family, for your community.
Excellent. Thank you for that. Well, thank you for being here. Thank you and being our guest and so great, gracious with your answers and generous. And go and please help our men because we will. I personally appreciate you for that.
Well, thank you for your confidence, and I enjoyed having this time with you. It's been a wonderful time.
Thank you, Dr. Burnett.